Good morning. I am Nick Rishwain. I'm the Vice President of Client Relations and Development at Experts.com, and this blab is brought to you by Experts.com. With me today is one of our members, Dr. Warren Seiler. He is a board-certified cosmetic laser surgeon and specializing exclusively in cosmetic laser procedures and injectables. He does expert witness work for both plaintiff and defense. And I am going to ask Dr. Seiler to go ahead and expand on that. Was I correct in covering the cosmetic laser procedures and injectables there, Dr. Seiler?
Absolutely.
Perfect. And can you expand on a little bit on your expertise?
Yeah, sure. So after medical school, I went through general surgery and actually was planning on doing plastic surgery afterward. And my last year of general surgery, got really interested in cosmetic laser procedures that we were doing. And at that time, this was about 10 years ago, those type of procedures were just becoming really popular. And like we were talking before, now the medical community and the community in general of potential patients is finally starting to recognize a completely separate specialty of cosmetic laser procedures, which can include injections like Botox and filler. So I spent almost a year after general surgery traveling to multiple different states, taking different laser training courses, and then ultimately got a specialty board certification in cosmetic laser surgery from the American Board of Laser Surgery, which is the only certifying board in the world, actually. I became the executive director of the American Board of Laser Surgery shortly after that. So I do a lot of work with state medical boards as far as regulations and state laws go regarding these procedures. And I'm a board examiner. I've examined and trained practitioners and physicians in 11 different countries. And I do a lot of work for a company called Allergan, which is the maker of Botox and several different types of filler. So I'm a trainer for them. I have my own training company to train people that want to come to my practice. And I've trained for other laser companies in the past. I don't do as much of that now, not much traveling, but most people just come here to train. So my entire practice is cosmetic laser and injections. I do everything but laser liposuction. So a lot of facial resurfacing with CO2 laser, Fraxel laser, laser hair removal, laser spider vein removal, tattoo removal. I do a procedure called IPL, which most people think is actually a laser. It's actually a pulse light device. And then probably about 35 to 40% of my total practice is injections like Botox and facial filler.
Interesting.
I've been doing expert witness work for about 4 years. I've done both plaintiff and defense, a little bit more plaintiff, but probably 60-40, I guess.
Excellent. So, and that's important, as we talked about before, and it's important for all of our experts for your credibility purposes, to show that you don't have any bias, to have a good mixture of plaintiff and defense work. Is that in part why you do it that way?
Sure, yeah. And I tell anybody that calls me about a case that I'll review the material and I'll give you my opinion, and it's irregardless of which side, quote unquote, calls me, and I certainly have done both, and I've been called by one side and disagreed with the thought process and told them that that they didn't have a case, or that they needed to understand why the other side was right or whatever. So I feel like attorneys that know me and have worked with me before know that they're going to get the same opinion regardless of which side calls me. So I think that helps my track record and my credibility.
Excellent. Yeah, it's very important, as I've talked about in other blabs here, that you have. To avoid looking like you're just a hired gun, and to keep your credibility, that you have a good mixture of both plaintiff and defense work, or some people will do prosecution and defense depending on their expertise.
The biggest thing with that is, in our field, you have certain, in all due respect, you have certain expert witnesses that no matter what, they always take one side or the other. They always take the physician side. They always, take the plaintiff side. And I think that those people are known. And so I think I've been told that attorneys like experts that give their expert opinion regardless of who calls them and what's involved as far as what they're trying to gain from the case. So, and I've done both medical board cases and civil cases. So.
And a medical board, for those listening who may not be familiar, can you tell me what a medical board case would be like? Expand on it. Is it disciplinary issues, or how does that work?
Yeah, I mean, usually that's you don't get many of those in my specialty because unfortunately most people don't realize that regardless of how strict the state law is, usually there's at least some level of physician involvement that has to happen with these procedures. Not that that's always followed. So when a complication like a burn from hair removal occurs, most of the time the patient doesn't know that they can report it to the medical board because they never did see a physician. But a medical board case would be when a patient files a complaint against a physician and the medical board is investigating the complaint. Now, usually attorneys are involved, but that's different than a civil case where there's a complication and a patient contacts an attorney and attempts to file a lawsuit directly without the medical board being involved. Either way, you still talk about medical laws and whether something illegal was done or whether it was just something done incorrectly or not with the treatment. But that's usually the two different ways that it happens.
Interesting. And now, do you do many of those, or is that kind of a rare occurrence?
Well, I mean, the first I guess year that I was doing it was, I guess, honestly a little less official. My first case was a defense case against a physician that I had trained through a laser company, and after.
Oh wow.
Yeah, and actually that was actually one of the first medical board cases I did, and he was found completely not at fault. I was able to prove that he did nothing wrong, and it kind of just went from there. Currently, I mean, it's unfortunately, even though I do enjoy doing it and helping, it's more and more common for physicians to get wrongfully sued, and it's more and more common for patients to have legitimate complications that they have every right to sue for. And so I have 6 different cases going on right now. But these cases take a long time. I testified in court for about a week last year after a 2.5 year, involvement before it actually went to trial. The ones that, go down pretty quickly are pretty quick, but if they go all the way to deposition and trial, then they take forever.
Yes. Yeah.
But, my practice is still the main part of what I do, but I do a pretty good amount of expert witness stuff now.
Excellent. Yeah, a lot of people don't understand that about 95% of personal injury 95% of civil cases, probably more than that, settle outside of court, and the process is incredibly slow. You're talking 2-3 years, and you're lucky if you're going to court after 2.5 years. I'm going to pause the recording for a second and see if you can refresh your browser. Yeah, so that is. You just said it, that a lot of people don't understand is how long the civil litigation process takes, and you probably write more reports and do more depositions than you ever do actual trial testimony. I'm sure.
Yeah, and actually, I tell you what, more often than not, it's as short as my opinion of whether there's a case at all, which generally is a pretty quick turnaround because attorneys always want to know how much time is it going to take and what the fees will be from the expert. Most of my experience, and for better or for worse, is it happens in situations where there's not much documentation, and so it doesn't take very long to review things. Pictures make a big difference. I mean, I obviously review everything that I can get my hands on, but pictures will make a big difference. I usually can tell if something is a normal, unfortunate, but acceptable side effect, or whether there was something, incorrectly done.
Right. If there's some negligence was involved. Right. And So, and we've talked a little bit about your expert witness practice, and that's great. But for let's talk about the cosmetic laser procedures and injectables a little bit more in depth as well. What do people most commonly come to your office or your clinic? What are they looking to have done? What is the most common these days?
Well, Botox is certainly very common. I mean, when I get asked that question, there's different ways to look at it. If you look at it from a patient visit number or from a financial, you don't make a lot of money on Botox, so you have to have a lot of volume for that to be part of your, bigger revenue. We see probably 30 to 40, maybe more patients a week for Botox. I would say my practice total numbers of actual just procedures is probably about 65% laser procedures and about 35% cosmetic injections. So it's a big part of my practice. Even though most of my expert witness work has been in lasers, there's not too many injection cases that are done. And that's not just me, that's across the board. But our most common patient is now a patient that is looking to have healthier, better functioning and better looking skin. And we have a lot of different options for them. We spend a lot of time with them. We do things a little differently than what I've heard most people do, especially from our own patients' experiences. We spend a lot of time with patients. We set up a plan for 6 to 12 months instead of just signing them up for a procedure. So, I think across the country, the reports are always that Botox and laser hair removal are the most common procedures done. If you look at the numbers, laser hair removal is certainly the most common thing that you will see in one of these cases. But I do a lot of much more advanced, much stronger type of laser treatments for major traumatic and acne scars and facial resurfacing. And I actually have a case going on with one of those type of lasers right now. But more of the expert work has been in some of the, I hate to say lower end procedures, but the more commonly, more simply thought of, although you shouldn't, procedures like laser hair removal, tattoo removal, stuff like that.
Okay, and the cases that I've seen through blogs and legal readings and publications that I get, I've seen a lot of the laser hair removal and tattoo removal and the burns coming from the lasers. But as far as, tell me, because I'm not familiar with it, I've had no laser procedure done, but it seemed interesting that you said you had dealt with some traumatic events and helping people to with some laser procedures and traumatic events. So what type of events were those, and what kind of work is required in that?
You mean, how do I treat those patients, or what have I seen in cases?
Not in cases necessarily, but in patients, the types of patients you've seen in traumatic events.
Yeah. I mean, the most common thing in the injection world is somebody that puts filler in the wrong place or uses the wrong filler. I don't think a couple of weeks goes by that we don't see somebody that's had a filler injection, something like Juvederm. If you knew fillers, you would know that that's the most common one used. It's a very good filler to help give volume back to the face and lift the face. And in any area where you've had, volume loss, most people try to fill lines with it, but it's really much more for recreating the normal proportions of the face. And that's why the more experienced injector knows how to correctly use it. Filler being put in the wrong place, and causing a
okay.
Injected improperly under the eye and causing tissue damage, stuff like that, putting it in the lip and causing so much swelling that they have skin necrosis. These procedures are very commonly done, but there's a very well-known plastic surgeon that is one of the best trainers in the world. He's trained people in over 40 countries. In the beginning of his lecture, he basically draws the anatomy on a human face with different magic markers. And by the time he's done, with all the different colors for the different structures, one color for blood vessels, one color for nerves, there is not a piece of skin that does not have something drawn on it. And he drops his box of markers and he goes, "Happy injecting." Basically, his point is that every time we stick a needle in somebody's face, you can cause a major injury,
Right.
On the laser side, the most common thing that I see is a patient getting a procedure done somewhere that just, in all due respect, has no idea what they're doing.
Okay.
These are lasers that can burn people. I mean, a laser hair removal device can literally take chunks out of your skin. And I mean, I've got pictures from cases to show it. That's one of the interesting cases I can describe later, which you said you would ask about.
Yeah.
But, I mean, just it's kind of like every time that you drive a car and things go well, you're like, well, this is no big deal. I can drive a car. Until you text somebody on your cell phone and you hit a 4-year-old. And I don't mean to be gruesome, but, all of a sudden, what seems to be a simple procedure when it goes right can go majorly wrong. And so, places do not seek out the proper training. They usually, like we were talking about earlier, they buy a laser. They have no idea why they bought one laser versus the other. They don't know the theory and physics behind it. They don't know why they're buying the device. They just know this is how much it costs and this is what it's supposed to do. They don't get the proper training and they start firing the device and they just, they don't understand what they're doing. And laser hair removal is difficult to do safely and it's difficult to do well. There's over 100 different devices on the market that claim that they can do it, and probably only a handful that I would recommend buying. And so, what I see in my practice, patients that come to me are patients that were either treated with the wrong device or treated with the right device, but the wrong person without the proper training. And, people get hurt.
Yeah. Yeah. And do you mention, do you do any anything based on, I thought you said something on a traumatic event. You said acne is common, that they'll come in for a laser procedure for if they had really bad acne at one point. And there was another type of event. Is it car accident? Do you do any laser on car accident or?
Sure. And when you're treating scars, you're talking about a whole nother level. In all humility, you're talking about a whole nother level of practice operating. When you're treating somebody with scars, we've done a series of laser treatments on a patient that went through a car window that is scarred on the entire left side of her face. We've made major progress with her. She's at the point now where if she's got a little bit of makeup on, you can't even tell she's scarred. We treat a lot of people that have had scars from incisions, whether they were done well and they just have a scar from it, or whether the surgery went wrong. I do a lot of laser resurfacing on patients that have had skin cancer removal and scars from the surgery.
Okay.
So we do a lot on the face and body, but obviously the face is the most common. We do a fair amount of treatment of people that have had congenital anomalies with port wine stains and birthmarks. If somebody's had some type of a chemical burn as a kid and, there was no treatments, 20 years ago, and now they have constrictured skin and either cosmetic or functional. It can, lasers can be used to treat, people that have had military injuries where their, muscle tissue is all scarred up, and it can help to release that.
Wow.
So, that's not as commonly done, obviously, as some of the other things like laser hair removal and spider veins and stuff. But something my practice really specializes in is treating significant acne scarring that, in all due respect, a lot of practices are not comfortable tackling, because you have to have a lot of different equipment and high-end lasers, and you really have to know how to aggressively enough treat the patient so they get a result. But there's a very, very fine line, and like with a CO2 laser, there's a very fine line between purposely removing lasers of skin and not burning and scarring the patient.
Yeah.
So
I would go into that more, but it would probably get too technical for our listeners today. But you're very passionate. I could tell it in your voice. Very passionate about your practice. Is it when you see somebody who's come in, not just for something elective? I wouldn't say elective, but when you treat those traumatic folks, is that how they feel about themselves afterwards? Is that really what does it for you?
Yeah, in other words, I'll answer your question this way. My favorite patient to treat is and I say this, I'll bluntly say this to them. We saw a new consult yesterday that has acne scarring. In all due respect to people that she's visited 5 different practices. She's later 40s. Some of those practices even have some of the modalities that will work, but have not used them properly. And she basically has given up and was kind of, this is her one last shot. We spent almost 2 hours with her in consult yesterday, and we've scheduled her for some treatments. But that kind of a patient needs skin health first, so we don't just throw a CO2 laser at them first. We may spend 3 to 6 months on medical grade skin care and smaller procedures to get them in shape for the bigger procedure. A lot of places, you walk in and they throw $8,000 worth of laser procedures, and you don't walk. We always kind of relate things to how people will think about it. And you don't walk into a gym and tell a personal trainer that you'd like to get in shape, and the personal trainer says, okay, let's go run a marathon next week. You get in shape first, you do a little bit of stuff here and there until you get worked up to the next thing, and maybe a year later we go run the marathon. So yeah, I love doing Botox and all the elective, which you correctly termed it. Okay. But my favorite patient, honestly, is the patient who has had problematic medical skin, acne and acne scars, sensitivity, and they've lost hope because they've tried a bunch of different things and things haven't worked, and they have no idea the results that they can get when they come to somebody that just knows how to properly treat that. And so I love all my patients, but yeah, that's the person that makes me the happiest, because you literally change their lives. And I'll say one more thing quickly on that note. I try to keep my comments short, but my passion comes through.
That's exactly what people want to see.
I think one thing that we do at our practice, besides having quality staff that are trained and me, the right equipment and the right ability to utilize and concoct a plan, is that we make people feel better about doing these things. I always say that the media makes you feel like you have to look your best because of all the crap in the media, but they make you feel guilty for doing anything to look better. No one would give you. No one would give you a hard time for brushing your teeth so your teeth don't rot. No one would give you a hard time for going to the gym so you look better. And no one would give you a hard time for wearing makeup or getting a new pair of shoes to go to a party. If these procedures are done by a trained professional and they're done safely and the patient doesn't go crazy with them, there's nothing wrong with having better looking skin. Right. Healthier skin. A lot of studies have hypothesized that the treatments that we do that reduce sun damage can reduce the risk of skin cancer. Some of the treatments that we do for cosmetic reasons help get the skin in so much better health that patients don't get acne anymore. They heal better from things, which decreases their risk of having skin issues in the future. So and the other thing is that every patient that walks in here goes, I know all of you other patients have a ton of money, but I'm on a budget. And I'm not kidding. I literally told this to a new patient today. She was paid. So the patient's ID number is the number of patient that they become. And she was number 10,100 something. Right. So we've had 10,000 patients come through here. And I tell her I can count on my hand the number of patients that we have that have just crazy exposable income. Right. Most of the patients are people like you and me that want to have healthier, better looking skin. Right. And
it's not the rich person's game. I think when plastic surgery was first coming up, and I should make that distinction, you do not do reconstructive and plastic surgery. Yours are cosmetic, laser procedures, and injectables.
I'm very clear with everybody, my patients and attorneys, that I am not a plastic surgeon or a dermatologist. I trained in general surgery first and then did a cosmetic training afterward to get a specialty board in laser and injection. So now I did a lot of rotations in plastic surgery, and I'm very familiar with surgery, but no, I'm not a plastic surgeon.
Yeah. And I wanted just to clarify. I think we talked about it at the beginning. I thought it'd be good to clarify it again in case anybody's come in. But I think the idea was the whole Beverly Hills kind of idea, where the people who were living there could afford those types of things in the past, or it's the Hollywood idea, and it's become a very common practice, and it's not just rich people who are having these things done.
Right. If you walked into my practice on a daily basis, not only would you think everybody looks normal, but you wouldn't think people are having things done. I mean, their before and after pictures show that their skin improves or whatever we're treating improves, but we don't treat, we don't have a practice of plastic crazy looking people that are, like on the show Botched and all that kind of stuff. I mean, yeah, that stuff certainly happens, but that's not my practice.
Right, and very cool. Can you tell me? This is really for my own interest, which these occasionally these go this way because you have a passion for your job, I have a passion for mine. One of them is I get to talk to people with these really wide-ranging areas of expertise on a daily basis, so I get to learn stuff on a daily basis. But this from experts in their field, and this thing would be interesting. Have you had like one of your a favorite success story, something that somebody was really self-conscious about and they've gone on to do something spectacular since they've felt so much better about themselves? Because I imagine how they feel does impact other parts of their life in the long run. Any success stories that way that you know of? Or
yeah, sure. We've treated a couple of well-known people. I've not treated somebody like Angelina Jolie or somebody that crazy famous, but we have more locally and southern famous people that have seen me. I've treated several patients that are contest winners like Miss Alabama, things like that. We've treated people that are in that beauty industry that or in the face of the public. The kind of the opposite of that is the patient that comes in that thinks they have horrible looking skin, and we do some things to them, and they, we've heard stories of somebody had actually we treated we're still treating her now, but for the last couple of years we've been treating a girl that really had horrible acne as a teen, and back in the day, that just even today acne is the most I'll go out on a limb and say that acne is the most wrongly treated skin condition what we have available now in current practice. And that is probably my favorite patient to see. And those patients come and they have been on antibiotics and they've been on drying cleansers and topicals and it's cream antibiotic Accutane, unfortunately.
Right. Accutane still to this day, huh?
Yeah, and I
remember when I was a teenager.
Well, and it's just not necessary in 99% of people. I've had one patient in my entire practice that we finally pulled the trigger on referring him to a dermatologist to get Accutane. Now, every one of my patients, so for full disclosure, since I'm not a dermatologist, I'm very clear that I do not do skin cancer. Every one of my patients will have a yearly skin cancer screening with one of the derms that I refer to. I will not treat them with a laser procedure if it's a pigment type of procedure without that. Okay. But going back to the example, so you get somebody that comes in that's tried everything, and we spend time educating them and getting a full history, and we find out that they need to be allergy tested, or the acne is hormonal, or what is the absolute? You're doing one of the worst things you can do to cause acne right now. This.
Oh, really? No kidding.
This thing right there is loaded with bacteria. And for people that talk on their cell phone a lot, we'll cure somebody of acne that comes in that's a secretary at an office that has one of those old-fashioned cushions that holds the landline, and she's got this big thing of acne right there, and she's seen a dermatologist who wants to give her Accutane, and I'm like, get a headset. And we cure the patient. So we had a gentleman that was kind of similar to the girl that I was telling you we treated. We had a gentleman that was in his 20s. He's probably our biggest success story. And we treat a lot of men, just to throw that out there. I mean, we've made it much more comfortable for men to care about how their skin looks and how their skin functions.
Right.
There's, it's like you're manly enough to go to a gym and get in shape. Well, what's wrong with, using a better cleanser and sunblock?
Right.
This kid is all over Facebook now, but he came in and he's given me permission to talk about him.
Okay. And you don't have to share a name, but yeah, you can.
Yeah, But he came in when he was in his early 20s. We've been seeing him for about 4 years now, and he was the quietest, most insecure, would not make eye contact with you. And long story short, he now has a girlfriend. He graduated college. He's gone to farm school. He's got a great job now. He's all over Facebook. His skin is beautiful. He honestly had some of the worst acne and acne scarring I'd ever seen.
Wow.
And he had done everything. He had been to dermatologists and other doctors for 20 years. He had tried everything, and took us some time to really get him where we were happy with it. But I mean, the kid literally looks like he had a skin transplant on his face. So that's what makes me happy, to see that.
And did I cut you off before you finished about the high school girl? We kind of went on the Accutane. You said she had
So, she just wouldn't do anything. She ended up going into college and cheerleading and, getting a great job after college and finding a boyfriend. She told us that she had never had a boyfriend because she came to see us because of the way that her skin looked. And she was overweight. She didn't leave the house, and she lost weight. It's very, and this is completely off topic, but we did a study, and when I was a surgery resident, we did a ton of gastric bypasses. And believe it or not, the divorce rate after gastric bypass was incredibly high across the country. Because generally what happened was, if it was single-sided and one of the two couple was significantly overweight, they were generally so mistreated that when they got the gastric bypass and they lost weight and started looking better, they were tired of the way the other one was treating them. And they divorced their significant other and went on and led a great, happy life. And, so we don't see things that extreme, but,
I see what you're getting at, though. I mean, it's the way you look and the way you feel it's had big impact on these people's lives overall. To not have a boyfriend.
There's nothing wrong with caring to look good and appropriate.
Right.
You don't have to. You won't get addicted. People are worried about if they start doing Botox. My patients don't look like they've had Botox. Botox is the most mythical, over thought of, I don't know what the right word is, but it's the most ununderstood procedure that we do. Botox is very safe. I've done 10,000 Botox injections in my practice. I think I just hit 10,000 last week, actually. Wow. I've never had a complication with it. I've been doing my own Botox for 10 years. The things we do, even in the straight cosmetic side, there's nothing wrong with doing them.
Interesting.
So
now, can't people go to an esthetician or something to have Botox done as well? Is that
not in Alabama? No, I don't think there's any state that actually will let an esthetician do it. There are a lot of states where you can be a nurse or a nurse practitioner. Which let me quickly touch on that.
Please.
There's a lot of argument in our specialty about who can do what, and the joke is, and I didn't make this up, so I'm not. I'm trying to be very appropriate on camera, but
Sure.
The derms don't think the plastics should do these procedures because they don't know anything about the skin, and the plastics don't think the derms should do these procedures because they don't know anything about procedures, and neither one of them thinks the family doc should do these procedures because he doesn't know anything about any of it.
Right.
I would take the family practice doctor who just smartly decided 15 years ago that insurance was going to destroy medicine and went and got trained and devotes his entire practice to what I do. One of the best doctors in the country that's extremely well respected is a retired family practice doc who has a laser center, and I would put him up against anybody. So it's all about how you get trained. Okay. There are nurse practitioners that I've trained that I would let inject me, and there are plastic surgeons that I've trained that are supposed to be the god of cosmetic that I wouldn't let touch me with if I was bleeding to death with anything, So it's really, and again, my passion comes through, but it's way more on what you have done to seek the proper training and specialize so that you don't become a jack of all trades, master of none.
Right. Right.
I know a lot of nurse injectors in some states that are great, and I know a lot of doctors that have no business doing the treatments that they're doing. Now, I know a lot of the opposite. I know a lot of doctors that are great and a lot of nurses that do injections that shouldn't be doing them, so.
Okay. And nurses who are doing them, they'll have to do them under a doctor's direction, right? Or in a medical practice.
Yeah, I don't know of any state that allows a nurse or a nurse practitioner or a PA to do a cosmetic injection without physician supervision.
Okay, all right.
And actually, the truth is that I've done expert witness stuff in a lot of different states, and what you'll find is usually the laws are better than they are known, and they're not enforced. In other words, we're in Alabama. We have one of the strictest laws when it comes to who can do what and how much the physician has to be involved. It's not enforced and it's not policed until there's a complication, and even then. So I think that
is that a lack of knowledge from the medical board who's supposed to oversee those things, or a lack of knowledge? Where do you think the failure occurs there, where they're just not enforcing it?
This is where I have to be careful to be politically correct, but in general, in most states, here's what it is, okay? And this is where no one could get upset with me for saying this, because this is the God's honest truth.
Okay.
Most of the laws have been written without someone like me writing them.
Okay. Yep.
You would not get an OB-GYN to give an opinion about laws regarding the practice of neurosurgery.
Right. Fair enough. Yeah.
And so these laws are generally written by people that kind of sort of do these procedures, but don't specialize them enough, because the specialty is just becoming recognized. Right. And most of the medical boards do not look at these procedures as a whole nother specialty that needs its own set of laws, its own set of training. And most of the time the laws say the physician has to supervise the treatment, the physician has to be properly trained, and the laser tech or esthetician has to be properly trained. Well, that's as far as they go. And so when something happens and the medical board calls Dr. So-and-so and says, somebody complained about you burning them with the laser, and the doctor goes, well, I'm well trained. And they go, okay. And 15% of people are going to have a complication, and that's why they sign a consent form. And that's as far as the medical board can go, because they've applied the law.
Yeah, so the legislation seems to be the problem. The legislation.
Right. We're working on that. I mean, that's a lot of what I do for the American Board of Laser Surgery. Has been my major objective over the last 3 years. It's been a very slow process, but we're trying to educate believe it or not, it's our medical board that stimulated all this with what I'm doing, because after having multiple consulting, discussions with them, they finally just said, look, we realize we don't know enough about these procedures. You need to educate us. So I started all the way from scratch and typed up a 100-page document that took me a year to do. And what we're trying to do is to get them to understand the procedures themselves so that the laws can follow. And, you just don't see that in many areas yet.
Yeah. Interesting. Yeah. And you said that this specialty, we've talked about it a little bit. The laser surgery and injections now have their own specialization. Is that the American board? Is that the one who oversees the specialization, or?
Well, so the American Board of Laser Surgery is the only certifying board for laser. There is no board. There is no board or oversight committee at all for injection.
Wow.
With the exception of the vampire group, the vampire facelift, which I'm a member of. It's the only thing that you have to be a member of to do injections if you're going to provide those couple of procedures according to the way they're done. Trademarked procedure. For those of you watching that have ever heard of it and are concerned about it, if it's done correctly, it's totally legitimate. It's not what the media makes it out to be. That's a topic for a whole nother discussion. Maybe sometime you and I can talk about the vampire procedures. It's basically taking plasma out of the blood and reintroducing it into the skin so that the skin heals better. It's been done for 15 years in surgery and wound healing. I used it when I was a surgery resident. The ortho guys have been injecting it into joints to heal joints for 15 years. And now, since the cosmetic world is so behind all that, honestly, the gentleman that guru'd it wanted to regulate it so it was done properly and trademarked it all. So now you have to train with him actually to provide those procedures. It's very regulated. Anyway,
but that's there is no one covering injectables right now.
Yeah, and there's not many people that do that, and there's not many people that are a member of the American Board of Laser Surgery. So now the ABLS is not yet an ABMS board, and so that's where the big problem is that it's not readily accepted because it's not one of the original boards. The ABMS hasn't let a new board in, and as long as I can remember, it's a big political thing. There's over 200 specialty boards in medicine and surgery that are not ABMS accepted, and the ABS won't accept any of them. Even the American Board of Cosmetic Surgery is not an ABMS board, and it should be. I mean, so there's a lot to do. I mean, there's a lot to do before things are the way they should be in our specialty as far as regulations and board certification. Now, I will tell you this: anybody that's ever taken the certifying process through the American Board of Laser Surgery, it is no joke. It is a very, very it is hundreds of pages worth of material to study. There's a written and an oral exam. It's about a 25 to 30% fail rate on first take.
Okay.
And you talk to anybody that's taken it and they haven't seen anything like it. We actually have become the certifying board for a lot of foreign countries that have no board whatsoever. I do most of the foreign examinations, and we've been asked to be the certifying board for multiple Asian and Middle Eastern countries. And you're talking about doctors that have more training. I tell you what, some of the docs that I've interviewed, especially from India and some of the Middle Eastern countries, they have months and months and months of training in these procedures before they even start. And
wow,
it's really impressive. I mean, we have a lot to learn from the way that other people do things.
Yeah, I don't disagree with that, and that goes across many different fields. We had talked when we were doing the test. I'm looking at your profile here on Experts.com, which I posted in the chat bar. I also posted your website in the chat bar. I'm going to post that again in case anybody missed that. But what is we've got it here as one of your areas of expertise, as one of them, IPL. What is IPL? Now, I'm sure that's a keyword that's of great focus for attorneys, but can you expand on that?
Yeah, so I'm glad you asked. So IPL, by definition, is intense pulse light. It's not a laser. The quick physics on a laser is a single wavelength of light. It's columnated into a beam, and it doesn't scatter in a vacuum medium, and it generally has one specific target. So it's one wavelength, it's one target, and it's a focused beam, and it has varying levels of energy in other settings. IPL is a wide range of wavelengths that is put through a pulse light device. And so you have multiple different wavelengths, and each wavelength can target something similar or something different in a color target. Some wavelengths target water, some wavelengths target pigment, some wavelengths target hemoglobin. And that's where, you have to know your physics. You have to know why you're using one wavelength for spider veins and a different laser wavelength for this.
Okay.
Most people think IPL is a laser. It looks like one. It works like one. It's a lot of the same theory in physics, but it is the most under-respected device and procedure on the market, hands down. And I say this.
What do you mean under-respected?
Sure. So, I say this to every patient, to everybody that I train. It is a good IPL device. It's a great device. You can treat sun damage with it. You can treat acne. You can photorejuvenate the skin. You can stimulate collagen. You can treat spider veins. You can treat rosacea, melasma. But it is not a laser, and it is one of the most common things that I'm an expert witness in, and it is one of the most common things that is quickly bought and handed off, in my experience, to someone that doesn't know what they're doing, and it's handed off by someone that doesn't know what they're doing because, quote unquote, it isn't a laser. you can cause third degree burns with IPL with the snap of a finger.
Wow.
Now the beauty of it is it's a great device. I mean, it's kind of the bazooka approach, and the bazooka is great when you want to blow something up, but when you want to shoot a duck, you don't use a bazooka.
Right.
And so it's very under-respected. The other thing about it that people don't realize is that the more sophisticated systems have a lot more parameters that you can change and manipulate on the device. So for instance, a laser hair removal device may only have energy and pulse width. It's got one wavelength, so you can't change the wavelength. Okay. It's got energy setting, and it's got pulse width, which is the time that each shot takes to fire. Okay. Now, those are important to understand why you're changing those. My IPL device you can change the wavelength, you can change the power, you can change the pulse width, you can change the number of pulses, you can change the time of each pulse, you can change the time of the delay. So it's a great device in the right hands, but it's very, very complicated. And from what I've seen in the cases that I've done where there was a problem and there was negligence, more often in the plaintiff side, they had no idea. They had no idea what they were doing. One of the cases that I was involved in that took about 2 years to come to a head, last year finished, was an African-American patient that was born, and this is public record, so it's fine for me to talk about it.
Okay.
An African-American patient that got burned with IPL, and she went in. The place gave her no consent, no education. They told her it would help rejuvenate her skin. You should never, ever, ever, I can't say the word never, ever enough, you should never treat an African-American patient with IPL. If you asked me if I treated a patient with IPL, I would say 100% of the time you would burn the patient.
Okay.
It's just one of the devices you don't use on an African-American patient.
Interesting. Okay.
And, it's kind of like, well, if it works for this, why shouldn't it work for that? It's the if all you have is a hammer, everything looks like a nail.
Right.
Phrase. If you have one device and you spend $180,000 on it, it's kind of hard to use it, to not use it for other things that you think it might work for. If you used IPL on a tattoo patient, you'd blow a hole in their skin.
Okay. So, with the African-American patient, that's, I'm assuming, a pigment issue. And the reason you don't use this is based on pigment of the skin. Is that
right?
Okay.
So the wavelengths in most IPL devices will directly target melanin, which is pigment.
Okay.
Most lasers do not directly target melanin, but indirectly. So CO2 laser targets water. You can indirectly target pigment by heat translation, but you don't directly target pigment.
Okay.
Because IPL directly targets pigment, you can imagine that if you're treating a couple of brown spots on a Caucasian, it can be a great treatment. But if you multiply that density of pigment by 100 to 1,000, like you have in an African-American patient, or by 1,000,000, which is what you have in a tattoo patient, you literally have a depth charge that will just literally blow holes in the patient's skin and cause second and third degree burns.
Wow. And
people don't realize that. People that use these devices just, and the other thing is too, is that, there's not a lot of patient education. Most of the time the consent is very improper. There's not much of a physical exam. And, things are advertised. Laser hair removal works great. It works great. And everybody, I know I'm being a little melodramatic,
okay.
But, here's one quick example. I graduated medical school with a guy that is very, very smart, full family of surgeons, third or fourth generation of surgeons. Went through medical school and hated general surgery rotation. And I'll never forget his face. He walked down the hall just saying, I will never be a general surgeon. He ended up becoming a radiologist. He married an internal medicine doc. And when my wife and I went back a day early from my 10-year medical school reunion a number of years ago, we sat down and we were shooting the bull. And I was really one of the few people that did anything cosmetic in my class. And to get to the point, he asked me if I did laser hair removal, and I said yes. And he goes, well, I've got a funny story to tell you. He and his wife Groupon, got on Groupon and got laser hair removal. Luckily, they didn't have any complications, but it didn't work. It was a waste of his money. And so I looked at Jill, and Jill knew what was coming. I just looked at him. His name is Ty, and I said, Ty, let me ask you a question. You're a physician. You're a very successful radiologist. You come from 4 generations of successful physicians. what did you think about laser hair removal before you walked into the practice? And he said, well, what do you mean? I said, what did you think about it? What did you know about it? Did you know the success rate? Did you know about the complications? He goes, Warren, I hate to admit this, but I didn't know anything about it. And I just didn't think anything negative or was possible. And that's unfortunately, that changed my view a number of years ago, which is that in general, you got to be a smart patient.
Right.
Okay. And I'm not taking away from the fact that you got to have a little common sense. And if I charge $500 for a procedure and you can get it somewhere for $50, you do the math.
There's a problem.
But it is the responsibility of the physician in the practice to be properly educated and to properly educate. And patients don't know the difference. Right. And unfortunately, most practitioners don't either. And that's why you see these complications. I got called to be an expert in a case, one of the first cases I did. And I saw the incredible or the entire video testimonial of the physician that burned the patient. And he was really a good guy, and he just had no clue, and he was at fault. But
yeah, it's difficult.
But it's just not. Procedures are not something to take lightly, patient or practice.
Yeah, you're using a weapon. I think. Yeah, you think you kind of alluded to. I mean, this is this. Whether it's the IPL, these lasers, I mean, can do a lot of damage. It would be like a weapon if used improperly. So, Mike has asked, and Mike's been on several of our blabs in the past. He asked, "What is the best specialty to seek treatment for turkey neck?" Now, I don't know that turkey neck is a medical term, but I think I can visualize what he's talking about.
It's as close to a medical term as you can get. That's a great question, and honestly, I could talk about it for 3 hours. But the long story short is that, in general, here's the way that I look at things. I'm 39. Like I said, I use my own skincare. I've taken very good care of my skin. I know you probably can't see from the video. I don't have any lines in my forehead anymore because I do my own Botox. I've had filler one time to give me a little bit of volume in my cheek. I don't do anything crazy. And I tell patients that if you have laxity in the lower face, you've got to figure out where it's coming from. Do you have damaged skin that needs to be resurfaced? Do you have facial loss or volume loss? So, if you can take one finger and pull on the cheek and be happy with the way this changes, that's probably a little filler. If you take two fingers and have to pull that much, here's the thing. Ask the patient what will make them happy.
Okay.
You've done it in the mirror. You've done something in the mirror to make you happy. Otherwise, you're not the kind of person that ever looks at yourself. So if you take two fingers and that makes you happy, that's probably some filler and a laser tightening procedure of some sort. If you have to do this, that's the surgical sign. And if you have to move that much skin to see the result that you want in the lower face, then almost always that is plastic surgery. Okay. Unless you are going to spend a ton of money in my type of procedure. So if the patient does that, then I educate them about what I have to offer, but I get them in touch with a good plastic surgeon that I know. I like them to get surgically evaluated first, and then they either rule it in and then I can take care of them forever for 20 years, or they rule it out and then they're comfortable. So here's the thing. I mean, it totally depends on how much you have. If you've got a little bit of skin laxity, you might be a good candidate for doing a little bit of volume in the face to give you that cheek height again that lifts the face, and a laser tightening procedure in the face and the neck, you might be fine. But generally, if you've really got a pinch of skin that is really the wobble, then more than likely you need a lower face and an upper neck lift.
Okay.
So, you could certainly come see someone like me first. I'm not going to do a procedure on you that won't make you happy. I would say a significant number of people that we see, I will refer for something else like plastic surgery, dermatology, hormone evaluation, allergy evaluation before we treat them. But yeah, in general, if you've got skin that looks like it needs to be removed, then in general, that's going to be surgical. Now, there's one new thing that's come out, and we're actually holding the training for Alabama on it on Friday. It's a product called Kybella. that Allergan is now manufacturing with the company that makes Botox. It's a very reputable company. And it will take care of what we call submental fat without having to do liposuction, but it's only for a little bulge right there in an otherwise relatively tight-necked patient. If you have that, then you're not going to be a candidate for it.
Interesting. Well, that's great information. Well, we have about 5 minutes left in this scheduled blab. If anybody has some questions that they'd like to ask, it's how old has your youngest patient been for hair removal? Interesting. I guess we do. I probably should answer questions a little sooner, but it seems that Dr. Seiler and I have already figured out that there's plenty more to talk about in future interviews.
I'd love to do it again.
Yeah.
Yeah, I mean, I can answer the question pretty quickly. We've treated a 9-year-old for hair removal on the face. Generally, you kind of say that in most skin conditions, you want to wait until you feel like they've reached maturity so that things don't change. The two exceptions to that are hair removal. If a 9-year-old girl has hair, puberty is not going to change that. It's only going to make it worse. It's perfectly safe. I've done underarm laser hair removal in young girls that are cheerleaders that were really embarrassed by the darkening of their underarm. I've treated birthmarks and port wine stains in babies and children. So yeah, you can. There's really no limitation there as long as you're doing it correctly and it's safe.
Excellent. Is there anything that we haven't covered, whether it be for a patient or for an attorney or just about your practice in general, that you'd like to kind of sum up before we close up for today, or before I pause the recording?
I don't know. I mean, I guess, to the attorneys that are watching, I'd be happy to, I do have fees, but I don't charge anything for the first initial talk just to see if I'm the right expert witness. I think one thing that we didn't talk about that attorneys have told me they appreciate is that I'm going to be very blunt with you and tell you who I am. I will tell you if I don't think I'm the right specialist. If it's like I turned one down that I started to look at just last week, actually, that was a complication from a laser on top of surgery. And because I don't perform that surgery, even though I can give an opinion about the laser treatment, I'm not the best expert witness. So, I'm not going to take your money as an expert if I'm not the absolute best one.
Right.
For patients that are watching this, especially for those who have been to other places, there is a huge difference between, just because I say this all the time, just because I'm a physician and have an MD behind my name does not mean that I am without ability to fail and do things wrong. I think people tend to trust. I've found, and I've even seen this in research reports, that the general public tend to trust people with higher levels of education more than those without. And I hate to say it, but I've seen just as many untrustworthy professionals as I have seen untrustworthy non-professionals.
Yeah, absolutely.
You got to do your research. You got to be smart. The last thing I will say to patients is, don't do these things cheap. If I had one word of advice, in almost every case that I've done, except for one that I can remember where I was on the plaintiff side, the patient went somewhere that they shouldn't have gone to. And they knew it. They did a Groupon thing, which let's talk about one more thing.
Yep,
technically,
it actually popped in my head as you were saying this.
What's that, Groupon?
Yeah, the discount for this type of stuff.
Technically, if you really look at the legality, and I've talked to my attorney about this, technically, if you look at the legality of the Stark laws, it is against the law for any physician to offer a procedure on Groupon because it's fee splitting. And to explain that, if you, Nick, are a plastic surgeon and I'm me, and you refer me a patient for CO2 laser instead of surgery, and I charge $3,500, I can't send you a check. Now, I can take you out to dinner. I can give you a free treatment. I can give your wife free Botox. I can send you flowers. But you can't financially benefit from my charged procedure. And that's exactly what Groupon is.
Right.
Groupon is charging the patient a certain amount and splitting that with the physician. I mean, it's against the law.
Yep.
So, that's my last word of advice to patients. Just, be smart about these things. There's nothing wrong with doing them. I think you've heard my examples of people that we've made happy and continue to make happy. And don't feel like you have to spend $8,000 to get good treatment. I mean, we tell patients all the time, we have plenty of patients that come in just to get on better skincare that you have to get from a physician as opposed to over the counter. And we make huge changes in people's skin just, for $100 or $200 a month worth of something. So.
Yeah. Fantastic. Well, this is great, Dr. Seiler. I appreciate you being here.
Thank you very much. I really enjoyed it.
My pleasure. And so again, I'm Nick Rishwain, and today I'm the Vice President of Experts.com. This blab was brought to you by Experts.com. Dr. Warren Seiler was our guest today. He is a cosmetic laser surgeon specializing exclusively in cosmetic laser procedures and injectables. I have posted his website throughout. He can be found at Seiler Skin and Cosmetic Laser.com, and he can also be found on Experts.com.
All right, you can just remember SeilerSkin.com.
Seilerskin.com. Oh, we should revise that on the profiles as well. We'll take care of that.
Yeah, that directs to the longer address.
Excellent. So I'm going to post those, both those, your expert witness profile and your website. Let me get the Seiler Skin for Seilerskin.com. Did you say?
Yes, sir.
Let me post that one as well. That. Seilerskin.com. So that's where you can find him. He is a cosmetic laser surgeon located in Alabama. Is it Homewood, Alabama? Is that where you're located?
Yeah, Homewood's Birmingham is the major city, but Homewood's just a suburb.
All right. So Birmingham, Homewood, Alabama. Thank you again for being here, Dr. Seiler.
Great. My pleasure. Thanks a lot for having me. I really enjoyed it.
Thank you.